Time for the Slocum-Dickson Medical Moment. We do it every single month here with our friends at Slocum-Dickson Medical Group. SDMG.com, SDMG.com. They're located on Burstone Road, New Hartford, 798-1500. Adrian, of course, in studio. Adrian, how you been?
I'm good. How are you?
Fantastic, fantastic. Now, who did you bring with you today?
Because February is Heart Month, as most people know, I brought our cardiologist, Dr. Kumar, here to talk about just some ways to stay heart healthy and how you can maybe prevent some disease.
It's so funny because the technical terms. Dr. Kumar, number one, good morning. How are you?
Good morning.
So thank you for getting up early and coming in. You can tell he's going to work after this. He's got the full scrub regalia and whatnot.
Yeah.
Everyone knows someone who has dealt with heart disease and heart attacks, and unfortunately, it's a sad thing. And you can tell just by the amount of participation in America's Greatest Heart Run and Walk, which is going to be happening in a few weeks. What are the warning signs? Because that's the big thing, is obviously prevention. But what are the warning signs? Is it the same for guys and for girls? Is it the chest pains? Because what I've always heard was chest pains and like a tingling down one arm kind of a thing was like the big thing. Is that an old wives' tale, or is that like in the wheelhouse?
So the classical symptoms of angina or chest pain coming from a lack of adequate blood flow to the heart muscle is chest pressure in the middle of your chest, what we call as the sternum. Sometimes it can go down your left arm, and it typically tends to get worse with activity, and when you rest or take a nitroglycerin, it gets better. So this classical angina is not always seen. So a lot of times patients have very vague and atypical symptoms. It could be as vague as symptoms from your lower jaw up to your belly button.
Oh, wow.
So if you just remember that any vague symptom between the lower jaw and your belly button, if it's something really persistent and, causing discomfort, might better get checked. For example, it could be a bad indigestion. And it could be sometimes very bad shortness of breath, or it could be just left arm numbness without any chest pain.
Sure.
Or it could be shoulder pain, behind your left shoulder blade. You may have like bad tightness, or it could be a jaw ache, So these are some vague symptoms. Women are more likely to present with more atypical symptoms. That's one of the reasons why they present later than men. So I think the more awareness people have with recognition of these vague symptoms, and if they are feeling really bad, might as well just call 911 or go to the ER and get checked. If it's not a heart attack, when they roll it out with EKG and serial blood tests, then it's safer than being sorry.
Yeah, absolutely. Can I share a story? It's very embarrassing on my end, but this was before I had gastric bypass. I was over 400 pounds, and the brown chicken, brown cow happened.
Oh boy!
And afterward, I'm laying there, and like I had the chest going, and I had like my arm was numb, and I'm like, oh my god, I'm having a heart attack. Oh my! And at that point, because that's what I heard, it's the chest and the arm, and I'm like, oh my god, I'm having a heart attack. Like, I'm freaking out. Like, oh my god, I have to go to the hospital. So I got tickets, and my wife at the time was a nurse, and she's like, please, for the love of God, don't tell them what we were doing before you started this, because just don't. And so I go in there and I tell, of course, I'm like, I want to give you all the information. It's not like I was just sitting there. So they go through, and they take fantastic care of me. They go through the whole thing. And turned to find out after they were very nice. Every nurse in the ward came and checked in on me. Amazingly enough,
that's nice.
It was agita. It was indigestion.
I see.
It was, but it was enough to scare. It scared the hell out of me.
It is.
It really and truly did. Now, as far as that story will get brought up to me later. What kind of things can you do in your day to day to kind of help? Because it seems like just like little tweaks can really make a difference, right?
True, definitely. If you look at heart disease, there are a lot of risk factors that put you at risk for heart disease. There is a category which we refer to as non-modifiable risk factors, which you can't do much about, like your age, a positive family history, or your genetic background. But there are a lot of modifiable risk factors which we could work on and be aggressive with our daily, lifestyle. Smoking is the number one. So people who smoke, they got to really look at the, chances of their adverse effects with smoking,
Right.
Like a heart attack, and they need to quit smoking. Diabetes is a strong player, so getting annual health visits with your primary care physician and getting checked for diabetes.
So if
is important.
you're diabetic, that could increase your chances of heart disease as well.
Correct. Diabetes is almost considered like a heart disease equivalent.
No kidding.
Yeah.
Oh
and
wow.
Then, so heart disease is more extensive in people with diabetes. They have long diffuse coronary artery disease, and the symptoms are also very vague.
Yeah.
So it's always better, to get checked out. Hypertension or high blood pressure is another strong player. So you want to make sure that your blood pressures are checked, when you go to your physician's
What
visit.
about doctor? What about diet?
So yeah,
I always heard like fried foods are like you should try to avoid them if you could because those kind of clog. Is that true?
Definitely.
Okay.
Diet is a strong player in combination with other risk factors. So high saturated fats, like in a lot of fried food, can increase your cholesterol levels and increase the plaque formation inside the arteries. And then omega-3, fatty acids might be helpful, in reducing your risk. And and also like changes with your diet patterns, cutting down your saturated fats, increasing more of whole grains, fibers, and then combining it with regular exercise. So it's a good way to reduce your risk.
Yeah, and obviously people aren't going to go and do like wholesale changes, but even if you just make one little tweak here and there, it's going to make a huge difference.
Definitely, yeah, it will. Yeah,
absolutely. It is the Slocum-Dickson Medical Moment here on KISS FM. We have Adrian and Dr. Kumar, the cardiologist from Slocum in studio. SDMG.com. Of course, like their Facebook page as well. They always have lots of stuff going on, especially lots of stuff going on with Heart Month. Yeah.
Yeah, a lot of stuff with Heart Month. One thing I wanted to say too is Dr. Kumar talked about some of the risk factors, and one of the things is you may not know you have these risk factors unless you're seeing a physician. So,
absolutely.
We always encourage people to get a primary care physician. Things like, high blood pressure, high cholesterol, whether or not you have diabetes, you could walk around having these and you don't even know it. So we always encourage people to, check out our list of physicians that are taking primary care patients because that's really important. As for Heart Month, though, we will be participating in the whole Heart Weekend. We'll be at the expo. You can come by our table. We'll have a bunch of information about keeping heart healthy. We're also going to do some different kind of fun screenings and stuff for people, some fitness tests and everything. So it'll be a really good time. If you want
I'll tell you what. But all it takes is one of those tests, and that could be, if you got to catch it early, and that's with anything. But if you catch it early, it really means a huge difference.
Yeah, definitely. Yeah, I mean the important things: checking your blood pressure, making sure it's below 120 by 80. Having your cholesterols checked. We focus more on the LDL cholesterol or the bad cholesterol. You want it at least below 100 in high risk people, and if someone has known heart disease, it should be below 70, and your triglycerides less than 150, and like that, and your A1C or the diabetes number below 7 at least. So at least are some of the basic things that could be checked when they visit with their primary care, and make sure that all these risk factors are under control, and combining this with a good diet and exercise program would help reducing your risk of heart disease.
See, all the numbers I don't get, but my primary is Silveraja at Slocum, so I go and get everything tested, and they're awesome because they'll just be like, okay, this is high, this is low, this is good, this is high, you got to work on this, and but doing that at Slocum really does absolutely help. It's SDMG.com. It's Slocum-Dickson Medical Group located on Burstone Road, New Hartford. 798-1500. 798-1500 is Heart Month. Make sure you catch them at the Heart Expo, the weekend of America's Greatest Heart Run and Walk. Adrian, Dr. Kumar, guys, thank you so much. We definitely appreciate it. We're going to break, come back with Vic Pop and Ben in the morning on KISS FM.